been reported that plantar fasciitis occurs in 2 million Americans a year and in 10% of the U.S. population over a lifetime. The pain is usually felt on the underside of the heel and is often most intense with the first few steps of the day. Plantar fasciitis is a painful inflammatory process of the plantar fascia. The plantar fascia is the connective tissue on the bottom of the foot. It is often caused by overuse of the plantar fascia or arch tendon of the foot. It is a very common condition and can be difficult to treat if not looked after properly. To better understand this condition, let's take a look at the anatomy. The plantar fascia is a thick, fibrous band of connective tissue originating on the bottom surface of the heel bone and extending along the foot towards the toes. There are three bands of the plantar fascia. There's a medial portion, a central portion, and a lateral portion. Primarily the pain is the plantar medial band of the plantar fascia. Left untreated, a heel spur can develop due to the pull of the plantar fascia on the heel bone. Developing a heel spur can complicate the treatment of plantar fasciitis. However, both plantar fasciitis and the developed heel spur can be treated non-surgically by following a few simple steps. Let's discuss the non-surgical options for treating plantar fasciitis. Cortisone shots, stretching exercises, shockwave therapy, and custom orthotics. Cortisone is a powerful anti-inflammatory medicine. The medicine reduces inflammation at the injection site and increases blood flow to the area, which promotes healing. The effects of cortisone are temporary, lasting anywhere from a few days to several weeks. Step 2 involves stretching exercises. We typically give our patients something called a night splint. A night splint is a stretching device that the patient utilizes approximately 1 hour every day in order to stretch the bottom of the foot. I usually have my patients stretch for about 15 or 20 minutes first thing in the morning before they get out of bed, then near the end of the day when they get home from work, and finally before they go to bed at night. We also recommend patients stretch before and after any physical activity. Step 3 is extracorporeal shockwave therapy. This revolutionary, non-invasive surgical procedure uses sound waves to penetrate deep into the plantar fascia, breaking up the injured scar tissue and increasing blood flow to promote healing. The treatment is FDA approved, and Dr. Smith and Dr. Klein have had great success utilizing extracorporeal shockwave therapy for the treatment of plantar fasciitis. Finally, step 4 requires the fabrication of a custom molded orthotic. Now that the inflammation has been resolved and the tissue has been stretched, it's very important to support the arch and control the biomechanics of the foot. A custom-made orthotic is key to the control of biomechanics and the support of the plantar fascia. By following the simple steps outlined in this video, the majority of our patients are healed pain-free within a matter of weeks. Sometimes patients don't respond to conservative treatments and require more invasive surgical procedures. There are plenty of options out there. Please feel free to ask us any questions, and we hope to have you pain-free soon.